This person says that they did an MRI and found fluid in their tubes, and antibiotics did not help. And there's the option to remove it because they have had 5 miscarriages. They don't want to remove it. They want to get pregnant first. They want to know if they still have a chance.
So, remember, when I'm answering questions, I'm not answering specific to you, but I'm going to answer the overall topic of someone who has fluid in their tubes. What are their options? Okay, that's what I'm going to answer. So when you have fluid in your tubes, it is thought, and this is called like a hydrosalping. So if the fluid is more like inflammatory fluid, it can be called a pyosalpings. Now, fluid in the tube, it tends to be considered toxic to a developing embryo. So the recommendation to remove the tube may have been because of that. However, there's a big catch of however. Once you remove your tubes, there is absolutely no way to get pregnant the natural way, and you would need to go on to having in vitro fertilization. So as I tell people, if there is absolutely no option in terms of you being able to afford IVF treatment or you wanting to do IVF treatment, then removing your tubes will not be an option, but your chances of conceiving may be, much lower because of that toxic fluid to the embryo. If there is an option for you to do IVF and you're willing and you can afford it, then removing the tube would be your better option, because then it removes that toxicity, that toxic environment for the embryo, and hence your chance of getting pregnant will be improved. Improved doesn't mean 100% guarantee, because in medicine I always preach there's nothing as 0, there's nothing as 100. Everybody lies somewhere in between, and what doctors kind of tell you is how close you are to 100 or how close you are to 0, but we can never tell you that there's no chance, and we can never tell you 100% guaranteed. So as I said, it just really depends on that, but your background scenario, if IVF is an option for you or not. That will really be your guiding force, as well as speaking.
I have another question. And okay, so I guess you would know the syndrome AMH.
So it's a test, Anti-Mullerian Hormone
syndrome, hormone, right? Yeah. So they want to find out if they're able to be pregnant, and if they're in the 40s, if that could happen, if it would lessen the chances.
So I will give a little background of it before I answer the question, okay? So there's something called ovarian reserve testing that is done frequently when a woman experiences infertility. And I want to stress on that it should be done when a woman experiences infertility. It should not be done in isolation. A lot of people market this test, and a lot of people think that this test is a fertility test, and it's not. There's absolutely nothing I can do to tell you how fertile you are or not. I can tell you probabilities based on these numbers, but somebody who has a low probability can get pregnant, and somebody who has a high probability can still not get pregnant. So these tests are not fertility markers, and they're not 100% guaranteed in either direction, okay? They're just kind of giving us probability, and it's best used in someone who is already experiencing infertility. The point of the test actually is not to tell us about your infertility, but more to tell us that when you seek infertility treatment, how likely you are to respond to the treatment, how good you are going to respond to the treatment. Hence, I said you should already experience infertility, because then you would be somebody seeking treatment. So there are 3 components of this test. We can do a basic ultrasound and do something called an ovarian reserve testing. And this is when, at the beginning of your menstrual cycle, on day 3, when you start to bleed on day 3, we look at your ovaries and we count how many follicles have started to develop. So that's ovarian reserve testing. That's one test. The second test we can do is measure your hormones, the follicular stimulating hormones. A lot of people know this as FSH, and luteinizing hormones, LH. And this is also done on day 3. So these 2 are cycle dependent, and we can tell how many eggs and how much you have in your reserve. The last test, which is what she's asking about, anti-Mullerian hormone, can be done at any point in time. It's not cycle dependent. We can do it today, tomorrow, any day. And this tells us more or less the estimate amount of eggs you have left in your ovary. What the test doesn't tell us is how good the eggs are, the quality of the egg, if the egg is going to be released, if you're going to ovulate, if the egg could be fertilized by a sperm, which is why it's not really a fertility test. It's more a quantity game as opposed to a quality game. Now, getting pregnant is a combination of both quantity and quality, but more so quality, because if you have 100 eggs and none of them are good, you will not get pregnant. And if somebody has one egg and it's a good egg, it will be able to get pregnant. So using AMH by itself without having experience in fertility, it's not necessarily the most reliable marker. But what I would say is, as you increase in age, because she mentioned age as well, as you increase in age, your fertility does go down, and specifically, especially in women. And as you increase in age, the amount of eggs you have left in your ovary also goes down. And that's where the age comes in. So older women tend to have a harder time conceiving. It doesn't mean that you will not conceive, because it depends specifically on what your body is doing at the point in time. If you're producing eggs, if you're ovulating, if the eggs are good quality, if you have sperm, there's no obstruction into the tracts, and your lining is good, you still may be able to get pregnant even though you're 40 or over, and have like a lower AMH. So it's not a test of fertility testing, which is what a lot of people market it as. It's more just how well you are going to respond once you're treated.
Wow. And the other question I think we broke when this was asked, it was about suspected endometriosis and fertility. The person is asking, in the context as well, with the woman get a day. What is FSH? You will know that, the FSH test. That's what you were just talking about.
That's what I was just talking about. Follicle stimulating hormone. Yeah.
So that's a question that she was asking in addition to that. And they are grateful for the doctor's name. So I guess they're going to do the research, because I'm going to do that. Will be able to pass it on to others.
Okay, so endometriosis is basically where the lining of the uterus, which you normally shed during your menstrual cycle, that is found in other regions outside of the uterus. And the common places it can be found is the space between the uterus and your rectum. So it's found inside the pelvic cavity. Okay, so it can cover your bowel, it can cover the outside surfaces of your bowel, it can cover the outside surface of a uterus. It can be found inside the ovary, from the endometrioma. So it's basically abnormal finding of your uterus lining outside of the uterus, okay? The problem with endometriosis is that it responds similarly to your uterus with hormone stimulation. So in the beginning of your menstrual cycle, your uterine lining is building in anticipation of a possible pregnancy. Your endometriosis at the beginning of your cycle is doing the exact same thing, unfortunately. It's building. So when you menstruate and you shed the lining of your uterine cavity, the endometriosis, which is outside of the uterus, is doing the exact same thing. The problems that this can cause, and especially when how it's related to infertility, it could cause severe pain. Most patients with endometriosis experience severe pain outside of what a period should feel like. A lot of them can't go to work or school when they have their periods, and they actually fear their periods. That's how severe the pain is.
You said that. It's amazing you said that, because I want to stop at the youths, because is it something that you can detect from teenage? Because you hear all the pains that you would hear persons go through, and even in the office, some persons can't work, some people pass out. So is it, would you want to say, as a result of something going on gynecologically?
Well, I mean, there are 5 different theories, which I wouldn't go into right now because it's too long to explain. But there are 5 different theories as to what causes endometriosis. But could it happen in young adults and youths? Yes, it can. However, it's usually not detected so early, because think of it. Many teenagers don't go to see a gynecologist. Many parents don't believe in taking their teenagers to a gynecologist, which is another misconception. We're not just here for sexual and reproductive health. There's so many other things that we do. So if you have like a young adult or a child that experiences extremely severe, unbearable, passing out, cannot function periods, or even you as an adult, if you're experiencing these things, this is something you definitely need to look into, and it is possible that it could be endometriosis. It is very underdiagnosed, and partially because people don't come for diagnosis, but also I would tell you because a lot of gynecologists usually just kind of brush it off and don't look further into it. So it's a mutual problem on both sides of the spectrum that leads to underdiagnosis of the disease. But what it can happen when this tissue that's found elsewhere starts to bleed and shed, it causes things to stick together. So it can cause your fallopian tube to kink on itself, meaning that the egg no longer has that tunnel to reach into the uterus. And that's one way it could cause infertility. It can also take up a large volume of your ovary, which prevents the development of follicles and decrease the amount of follicles you have left. So people would have endometriosis have different reasons why they may not be getting pregnant. And once again, you have to look specifically into what is the reason for you. Is it a problem with the tube? Is the endometriosis affecting your tubes? Is the endometriosis affecting your ovary? And there are many people who have endometriosis that will get pregnant with no issues and relatively have no pain. So endometriosis is not just like a one way, like symptomatic thing. It presents much differently to different people. And also the outcome is different. So depending on if it affects your ovary or tube.
So you're saying that there are people.
Go ahead.
So you're saying that there are people that would get pregnant even if they're diagnosed with endometriosis? Because usually when a woman hears that, she just locks down and it's gone. She can't get pregnant. A lot of women believe that. And you're saying no.
No, there are women who have endometriosis and get pregnant. There are women who have endometriosis and don't know. And the only reason I can tell you why we know that they have endometriosis is either they have surgery for some reason and we see it, they have a C-section, and in doing the cesarean section, we see that their tissue is covered with endometriosis. Or sometimes on autopsy, it's found that the patient has had endometriosis, but it hasn't affected them the same way as other people. So on the far end of the spectrum, people can have severe excruciating pain and experience infertility. And on the other end of the spectrum, people go around with endometriosis and have no clue that they even had this diagnosis. So depending on what spectrum.
Go ahead.
Depending on where you are on the spectrum will determine how easy or how difficult it is to get pregnant, and also what you need to do in terms to help you get pregnant. But it is possible to get pregnant with endometriosis. You just may need a little help.
Wow, I think I'll need to continue this on my other Friday evening program because I'm seeing questions coming, but I can't ask all. We just have 4 minutes. I got to play my sponsors. But my last question, it's about fibroids. And I think most women in the Western Hemisphere, is it a black thing? You know, you hear that from time to time. And so quickly, we just have like 2 more minutes to just answer this last question, and I'll definitely have a conversation with you to see if we could continue this on Friday evening.
Sure. The question is fibroids and what? Fibroids and fertility?
Getting pregnant and having fibroids.
Okay, so
the possibility.
Fibroids is very prevalent in the Black community. So it is thought to have like a genetic component. Depending on where your fibroid is located, very quickly, it could be located on the outer surface of the uterus. It could be located in the muscle of the uterus, or it could be located in the cavity of the uterus. If it's located in the cavity, it's where it's more than likely to affect pregnancy, especially if it's large and if it's multiple and if it's really protruding in the cavity. And the reason why is that it prevents implantation, or prevents implantation from occurring properly. Implantation is, think of the embryo trying to like send out the placenta like roots of a plant. The placenta is trying to root itself into the lining. And if there's a fibroid, there's no lining to really stick onto. If your fibroid is found on the external surface, those are less problematic. And if your fibroid is found in the muscle layer, then it just depends on the quantity and how deep it is in the muscle that will affect it. So fibroids is not an automatic sentence of infertility. And a lot of people would have fibroids and get pregnant easily. It's just quantity, quality, quantity and location of the fibroids. So we can continue this. Definitely, we would need to continue this at a later time.
Thanks so much. I'm sorry I couldn't get all the questions in. Please forgive me. We can do this on Friday evening. I think it will be necessary. But I really, really want to thank you for just giving us a little snippet, enlightening Trinidad and Tobago and the world, as it were. We're really appreciative. I know a lot of couples are. I'm seeing a lot of thank you on the WhatsApp page. You're welcome, you know.